Mga
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗁 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗁 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗁, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗁. I'm your host, Nicole Jacinto. Okay, yes, indeed, you've got questions and we've got answers. And today, we're going to ask Dr. Mark Austin Gawaran a lot of questions. He's an emergency medicine specialist in 𝗏𝗏𝗁. But hold on, Dr. Gawaran. Before we start, I'd like to say that our topic is, I'm very happy actually that we're taking up this topic. Our topic is heat stroke. Now, for us here in more tropical countries, for those of you who are watching, our listeners and viewers all over the world, by the way, thank you very much. Keep watching, keep rewatching our shows. Thank you for listening on terrestrial radio, on TV. There's a lot of platforms on the internet. Thank you for, for patronizing the show and the station. But for us here, for us here in more tropical countries and those near the equator, it's a very, very important topic. And in fact, for those of you who are near the poles, even though you are in colder climates, even during the summer, sometimes you will hear of like a heat wave that affects people. So if you'd like to really listen to the show and the information about heat stroke, I think it may help you also when it comes to the time when you experience heat waves, and also when you visit our country and visit tropical countries or countries near the equator. During the hot, I won't even say warm, but the hot season, you'll know more about how to handle things if you choose to come here at this time. And it's a great time to come. It's always a great time to come to the Philippines. But anyway, Dr. Gawaran, how are you today?
I'm good, except for the heat that we're experiencing all over the Philippines. I don't think it's just only in Metro Manila, but I think the rest of the country.
Yes.
But otherwise, okay.
Yes, indeed. It's not just Metro Manila that's experiencing this high heat index that we have, but like in Zamboanga today, it's 53. That's in Celsius. I actually don't know what that is in Fahrenheit. Yes. I'm more used to Fahrenheit, but I mean it's hot, and then we've been hearing about it for the last few days, weeks, and I'm glad that you gave us enough time. Thank you for being on the show. Thank you for sharing your time, knowledge, and your effort with us to explain things about heat stroke. So let's start with Dr. What should I call you? Dr. Mark? Dr. Austin?
Austin is okay with me.
Okay. Yeah. And you can call me Nicole. Okay, Austin. All right, Austin. So, Austin, can you tell us what exactly heat stroke is? And
right.
Yeah. Okay. Cool.
Yeah. Before we start, again, thank you again for inviting us over. This is a very topic that we really need to discuss. Everybody needs to listen to, because it's affecting not just like everyone, specifically from young to adults and even our elderly experience heat stroke. Just to put in perspective, you're saying the heat index yesterday or today in Zamboanga is 53. Put things in perspective. Our temperature, body's temperature, is at 37 degrees Celsius, right? That's our normal temperature. We'll experience fever when it started having at 38 degrees Celsius. Imagine imagine you being exposed to like almost a furnace at 53 degrees Celsius, walking an oven over. And that's what exactly heat stroke is. It's the capability. It's when the body's capability to regulate it back to 37 degrees, which is our normal temperature, fails. And that's when we started having the heat stroke. It's a dysregulation of our body's temperature thermometer, if you will. Like we have a thermostat
Yeah.
inside. It's the body's dysregulation of those thermostat. It fails. And now our body's being exposed to this high extreme heat, causing our organs to have permanent or temporary damages.
Okay.
And worse, death.
Okay. All right. So, doctor, it really is important. Like as you said, I'm so happy. Like you brought it up that way, and that's how you explained it. To give you an idea, our bodies are our temperature is 37. When it hits 38, it's already considered a fever, and yet
Fever,
outside it's 50. Let's say it's 53 or 46. I mean, that's pretty high. And I'm just repeating what you said, where we experience heat stroke when our bodies cannot regulate our temperature, and it's due to environmental factors. I mean,
exactly.
Okay. And so like your hypothalamus, correct me if I'm wrong anytime, because I'm just using stuff I know from like way long back ago, way back. Your hypothalamus can't, it's like a kid where
Can't regulate it.
you can't regulate it, and the rest of your organs are also kind of going nuts in disarray. It's like you are basically having a fever that you cannot control in that sense.
Control, exactly. And your organs are all causing, they're having this kind of reaction to this heat, causing all our proteins to dysregulate. But there are actually two kinds. I mean, most people will think heat stroke is one. Two kinds of heat stroke, actually. One is exertional heat stroke and exertional heat stroke. Of course, we are exposed to like what we used to know, the exertional heat stroke. Usually, it affects the younger individuals, occurs in a few hours, but exertional because you put a lot of pressure, a lot of physical activity in a warm and very hot environment, right? So it causes us to dysregulate it in a few hours. And there's non-exertional heat stroke. Just to those non-exertional heat stroke are usually the elderly and those who are sick. It occurs in several days. It's just the capability, not the body cannot just withstand that heat for a long period of time, that dysregulates, and that causes the heat stroke. One is exertional, occurs in a few hours, usually younger individuals. The other one is non-exertional, those are elderly or with illnesses, and usually occurs in several days.
Okay, thank you, doctor, for giving us the two types of heat stroke. Actually, as you said, one exertional. So, like, if let's say I were to go to the gym, which would be a miracle, that the gym that is not let's say they say, okay, there's an activity here like boxing or something, or dancing, which also would be a miracle if I actually danced in a gym in front of people. But air conditioner, and it's kind of like a closed environment, of course.
Correct.
That could be an exertional. I mean,
it can be an exertional heat stroke. You can have exertional heat stroke if you do that in a warm or like very close environment, no ventilation, no air conditioning. You started sweating, but because of the heat, very close environment, the body starts to have, initially, it's not just heat stroke, usually exhaustion. Actually, the first one is cramps. You started having muscle cramps, right? It's called heat cramps. No, it's because of the heat, and then you started your muscle soreness, and then cramps. When the cramps last for a long period of time, a few hours, it becomes heat exhaustion. Now your body tends to be very weak and nauseated. You started having this kind of symptoms. You start to have fast heart rate and rapid breathing before it pushes to heat stroke. Heat stroke is the pinnacle of the continuum. From the heat cramps to heat stroke. Heat stroke usually causes delirium. So you'll started having confusion, disorientation. You don't know where you are. You don't know who you are. Who are you with? No. Then some patients can also have syncope or loss of consciousness. They start fainting. Aside from the heavy headache, like really severe headache, they start to have some balance problems. Visual changes. And lastly, They can also have seizures. They start have like jerking movements, and if it will not be properly taken care of, heat stroke again can lead to possible death.
All right, doctor. Just to run through it again, there are, whether it's exertional heat stroke or non-exertional heat stroke.
Non-exertional.
You did mention there are stages, and you did mention the symptoms and what leads up to the pinnacle, which is heat stroke. No, I'm just kidding.
Heat stroke.
If you hit someone,
Yeah.
you can get a stroke. But we're talking about
Yeah.
heat stroke here. Okay. So, doctor,
Yeah.
can we just go through that again? Like, what are the symptoms when it starts? You mentioned cramps. Okay. Let's say
Cramps. So you start usually with cramps, right? Muscle soreness, you feel fatigued, very generalized, just generalized random body aches,
and then
So
you can feel malaise. You can feel malaise.
yeah, you have malaise and those kind of symptoms. Very, very, if you're gonna think about, very benign, right? Everybody can feel that. Like people will be working, not even having exposed to heat, they can feel that. But when these cramps last longer, that's when it is more, kind of like a red flag for us. When the cramp starts and lasts for several hours, and you're exposed to extreme, you're having either exertional, non-exertional efforts, then it can push you to the next stage. So from heat cramps, it can cause to heat exhaustion. That's when you start having really, these kind of nausea and vomiting. You started having these really bad headaches. Cannot explain where it's coming from. It's not something, especially for a person who's not a headachy person, who never had headache before, started having these kind of symptoms.
Dizziness, nausea.
It can have this kind of dizziness, because feeling like you're having flu, except you don't have flu, you don't have cough or colds, nothing else. You just feel like you're having flu-like symptoms, except you're being exposed to extreme heat. And then you started having excessive sweating. Even after you do the exercise, you still start sweating and sweating and sweating. Even if you went back to a cooler place, you started sweating, or the sweating lasts. You have this flushed skin and pale skin, no? Started having the cold, clammy fingers. Then that's heat exhaustions, yeah. And then that's the second part. No, again, it may last.
Clammy fingers. You're not exerting any effort anymore.
Or
you may even be in
you're still sweating.
It's affected you already to the point where you're sweating a lot. You're like, I don't know, I'm already in an air-conditioned room or something, but I'm sweating and I feel like throwing up. My head hurts. There's something off, right? Something off.
Yes, there's something off. You can actually feel it. And again, if you don't recognize the symptoms right away and don't do anything else, that's when the problem lies. And then it pushes you to have heat stroke. The main reason why it's called heat stroke is because it does represents like stroke-like symptoms. No, stroke-like symptoms include having confusion and disorientation.
You're saying earlier delirium.
Like you don't know where you are. Delirium, very delirious, So you started having that. You can also have balance problems. You started having gait problems. You can't walk properly. It's like something's off when you're walking. Or you can also have problems in movement and coordination, even like picking up things, or like you started holding up something and then having a problem of grasping on it.
Taking a glass of water
and then
this is not normal for this person. They may even be a person in their 20s or 30s who exercises a lot or whatever, but suddenly, whether it's exertion or not, they can't pick up a glass or a pen.
Or they started falling off from their hands, and not able to grasp it properly. So these problems lead to some patients would have seizures and syncope. Seizures like jerking movements, never had that before, or syncope and they started fainting, losing their consciousness altogether. So these may present like heat stroke already.
Okay, and doctor, when that's why you call it heat stroke. You mentioned earlier because it presents stroke-like symptoms. Can you just really quickly tell us what a stroke is, because especially for Filipinos and those living in the country now, sometimes actually just heard a few days ago na-stroke yung tatay ko. Somebody told me. Tapos na-stroke yung gano'n. Tapos, ma'am, anong gagawin ko? And sabi ko, well, just call me Nicole. Pero sabi ko, anong klaseng stroke? Kasi during the summer, doctor, di ba? Pag mainit, we hear people say na stroke. Pero then they're kind of like okay after a few days. So, maybe we're using terms interchangeably and just saying the word stroke. But there's a difference between a heat stroke and a stroke. So maybe if you can just
stroke,
if you can just outline that difference very quickly.
For sure.
Yeah.
So stroke in itself, no, it's a condition wherein the blood vessels, apparently our Filipino language can only know the vessels in our like body called ugat. No, everything's ugat. The inside, it's all ugat. No, but this, nerves are ugat, blood vessels are ugat, right? But this one, stroke is when the blood vessels inside the brain, which supposedly gives the circulation, gives food and nutrition and oxygen in the parts of the brain, either got blocked, so meaning the blood supply stops in that area, or the blood vessel rupture, so much so that the blood gets out of the blood vessel and the brain, right? So there are two kinds, right? One is a clot. It's a occlusion of the blood vessel. The other one is a hemorrhage. No, so the other one is a hemorrhage, so meaning the blood vessel rupture, and so the blood gets out of the blood vessel.
So in
that is way different.
Okay, sorry. Go ahead, doctor.
That's way different from a heat stroke. So a stroke in itself causes the blood. It's because of the blood vessel. Something happened in the blood vessel, decreasing the circulation inside the brain, and that's very anatomic in nature. Heat stroke is very physiologic, meaning it's a body's way to regulate it back to normal temperature. Doesn't have any problem with the blood vessels itself inside the brain. But what happens is because of the dysregulation or the ability of the body to regulate back to normal temperature fails, that's when it started having these kind of symptoms.
Okay, thank you, doctor. So I'll just recap what you said in more in our language kasi ugat. So when you say na stroke si ganyan, okay, pag stroke, it's either nabara, may flat, may bara, or I don't know how to say it, sumabog. Like, pumutok. Sumabog naman.
Pumutok. Yeah, that's actually the term that we use.
Okay. Either nabara or pumutok.
Number one, ang stroke po, if you're gonna put it in Filipino, I want to be very clear about it. Kasi even in our patients, they say the stroke, but sometimes it's not really stroke. So number one, stroke, it has to happen inside the brain. Diba? Kasi minsan na-stroke sa puso. Walang stroke sa puso.
Myocardial infarction, heart attack yun.
Heart attack yun. Yes. Ang unang-una, ang stroke, nangyayari inside the brain. It happens inside the brain. No? Second, kailangan it happens because of the blood vessel o sa ugat. No? Yun, tama yun. Dalawang klase ng stroke. Either nagbara yung ugat, no? At pangalawa, pumutok yung ugat. No, and it has different causes altogether. But again, it's about stroke. No, going back to heat stroke, walang ganong, nothing happened inside the brain. Nothing happened like that in stroke.
So kapag stroke, it nasa utak yun, and as you said, anatomical, kasi meron dun parang structure. Yung paggawa ng katawan, yung structure na mismo ng mga ugat tsaka yung brain, either nabara or pumutok. Pero pagdating sa heat stroke, iba naman yun. It's hindi kaya ng katawan mong alisin yung init na nagkakos ng mga simptomas na to. Pero very dangerous din. As doctor said, pwedeng. Okay, so basically, that's it. Because people will say, just out of curiosity, you said it's very different because people are like, pwede ka bang ma-stroke dahil mainit? Heat stroke, pero not it can't jump to a stroke unless somebody has pre-existing conditions.
Exactly. They already have risk factors altogether bago siya ma-stroke.
Okay. So going back to heat stroke, sorry, doctor, I just wanted to clear that up, because they're...
Yes, for sure.
Yeah. Okay. So going back to heat stroke, you've mentioned a lot of the symptoms and what happens to the body. What happens to the body? So this is what's going on in a patient's body and how the patient feels. You mentioned like cramps. Okay, so the person who is starting to get a heat stroke, the first stage is heat cramps, and then the cramps will last longer for how many hours? Whether or not you exercised in the heat or not. Whether or not you exercise in the heat or you're just sitting around, but somehow because of the heat and the intensity of the heat, wherever we are, it's been affecting your body for days already, no? Okay, so, and then you mentioned the second stage, which is the heat exhaustion. You also gave us some symptoms, which are you feel dizzy, you're vomiting, you could vomit, or you feel nauseous, you have a headache, you don't know where it came from, and then you, plus all the symptoms
excessive
of
sweating.
yes, incessant sweating, and then even if you're already like, okay, well, I was out there, but now I'm in this, I'm in this room, I can't stop sweating. I'm in this air conditioner, I can't stop sweating, and my hands feel clammy. And then up to the point where it's a heat stroke, where someone will have delirium. They may not know where they are, they get confused, and then they may faint. You said syncope. Okay, so they faint and all of that. So that's what actually happens to the person, and those are symptoms that they exhibit, and that's how the person feels. Now, as a, let's say, a companion, maybe an office mate, even a friend, a family member, or a bystander, or a good Samaritan. How do you, let's say you see someone and they've been experiencing this, but they haven't been telling you, right? How can you like maybe tell? I mean, even like from start to finish, even beforehand, like let's say someone, of course, obviously if someone faints on the road, you get help if you're a good Samaritan. But what are the ones that we can watch out for out of the symptoms you mentioned as someone else, not experiencing, but kind of hearing it? And what questions should we ask the people? Like, what day is it? What is 24 times 82, which I will not be able to answer.
Okay. So, well, number one is, so as bystander, like, non-medical person, anyone of us, and we check someone who we feel like someone needs help, no? So what are the things that we can actually see? Let's go with what we see first. So that's easiest, right? Usually they'll have shallow, fast breathing, like, panting almost, no? Even if they're lying down or sitting, they're, panting. I get to see them having trouble breathing. Second, if they can check the pulses or check and put on their hand on the chest and check for the heart, it's very fast, right? So sometimes you can't even count it. You don't even have to count it. Just like, it's fast, then, call for help right away. These things. Or
like, not doesn't have to necessarily be strong, or even is as long as it's just
doesn't have to be strong. Imagine the strength of the pulse is not just our ability, but also because of the fluids inside it, right? It's the pressure inside it, right? If there's not a lot, if you're losing a lot of fluids, and you might not have really strong pulse, but you might be very fast, right? So just a fast pulse, that'll be okay. A fast breathing, shallow fast breathing, like someone's panting, or they can also have like, I mentioned a while ago, you can easily check the nail beds, if they're pale, and they have cold, clammy nail beds, or fingers, fingertips, then in an area where they're not supposed to have cold and clammy fingers, right? They're outside, right? They're exposed to heat, and then starting having like these kind of cold, clammy fingers and feet and on toes and fingers. Then they have to call for help. Of course, you can ask what's their name. If they can answer you right back, then or ask for them what happened to you. If they can answer you back, then call for help. This might be symptoms already of heat stroke. These very simple things you can actually check on. You don't even have to be a doctor or a health-related individual. Just in case you don't, not sure about it, and you saw this patient needs help, then you call for help.
Okay, thank you, doctor. One question only, like just a follow-up question. When you explained about checking the nail beds, and seeing if they're cold and clammy, even the toes. And if you ask them, thank you for answering that question very thoroughly, because it's something that people are kind of shy to do sometimes, or they're not sure. They say, your fingers may just be clammy, and they have this instinct that the person needs help, but they're like, hindi, okay naman, because maybe the person who's experienced will say, no, no, it's okay, I'm okay. I just need to sit down for
Yeah.
a minute. When it comes to the pulse, where is the best place to take the pulse? If you cannot put your hand, or for whatever
On
reason
the
you
chest.
on the chest, where is the
Mm-hmm.
best place to take it?
Mm-hmm.
And can you tell us what fingers to use? Because when you take the pulse, like, is it the
Mm-hmm.
index finger?
Okay.
Okay.
Yeah, we use the index and the middle finger. Now, use two fingers now to really check on the pulse. For resuscitation, as an emergency medicine specialist, no, so the best place to put the pulse is in the neck area.
Neck,
Actually, it's
yeah.
in the carotid area. No? So you get to see the muscle here. I think my muscles are very visible. Anyway, on my this muscle, no, this shoulder muscle, when you check,
Yeah.
it's just underneath it, right? And you can actually check on the carotid pulse. Just put one finger on one side only, not on both sides. But
Okay.
this is very difficult to do. This is the best place, but more a bit difficult to do for an untrained person, right?
Yeah.
So for an untrained person, the best representation in adult individuals, in adult, no, use the hand and check for just on below the thumb, maybe
The
like
wrist area.
one
The wrist area,
thing, yeah,
one finger.
the space here, yeah. Yeah, just below
Okay.
the thumb, and then check for the pulse here. I can
Okay.
easily check. You don't have to push so much, no, just palpate a little, and then you can actually feel the pulse already. And that's for adults. No,
Mhm.
for of course kids or younger, because it might be too difficult because space is so small.
Mhm.
So we use usually the brachial pulse in the biceps, right? But
Okay.
then again, it might be a bit more difficult. For younger individuals, if you're not sure here, then you can use the femoral, which of course I wouldn't be able to
Yeah.
let you. It's in
That's in the
the
thigh
inguinal
area.
area, no?
In
Just
the
check on
thigh
the
bone area.
in the
Okay.
thigh area, no. In Tagalog, it's in singit, no? So singit, you check for
Sing
the
it,
pulse for
or
younger
bata.
individuals.
Thank
Sa
you,
bata.
doctor. Thank you. Thank you so much, doctor, for
Yeah.
that that question.
No, no problem.
And yes, you can
Yeah.
see muscles clearly. Very good, doctor. Uh, okay. Thank you for showing us. I mean, and for those of our listeners who cannot see, because we do have listeners who cannot see but they listen. No, that's why I ask
Mm-hmm.
uh, the doctor to be descriptive sometimes. So I'm sure they understand.
Mm-hmm.
They
Yeah.
got it from you. It's a sing it, or like in the neck area. But if you're not trained, they got it from the wrist. Use one finger. Thank you for that
Yeah.
information, doctor, because that's very important when it comes to, like, how can I tell if somebody is having
Yeah.
a heat stroke or not, or not, and then
Mm-hmm.
or building up to that,
Or any other, yeah. Yeah.
any other condition.
And
Okay. Mm-hmm.
yeah.
You were
So
saying.
definitely, not just for the heat stroke, well, you can actually check. It's actually a very, I think it's a mandatory, if not survival skill for everybody else. Not maybe for you, but to help someone else. For basic life support, to really check the pulse. So I'm happy that we're able to advocate here. You've given me a platform also, in
Yes,
your
please. You're an
program. Yeah.
emergency.
Yeah, as an emergency medicine specialist, yeah, we would really love everyone to able to know where the pulse is, to check it properly, and you don't know, maybe your loved ones, maybe your family member, that might need your. I hope not, but there will
Yeah.
come a point that everybody would have to help someone, and checking the pulse is one of the most vital things that we have to do, and
Mhm.
properly do it in those locations.
Okay. Doctor, when you suspect someone is having a heat stroke and you call for help,
Mm-hmm.
um,
Mm-hmm.
oh, let's say, okay, then the patient is what's the best thing to do? Like, bring the patient immediately to the
Yeah.
emergency room? Okay.
So number one is call for help, right? Because at least there will be somebody else to help you out, and make sure that everything's safe, not just for the person but also for you as someone
Mhm.
who would going to give help to that person. After calling for help, of course, you have to wait for a bit, right? People might
Mhm.
just so you have to put, and it's very important that you remove the heat from that person, right? So you get the person into shade or into indoors as much as you can, if you have time, if it's on the road, at least on the shade, that will be better, right? Or if like if they fell on a cement road, then you put it on like, a non-cement area. It might be cooler, right? In sandy, loamy areas, because there's some moisture in there, Then remove the excessive clothing, You can remove as much as you can. Yes. Just at least keep on something that might be more private, but as much as you can. It's not something that we be thinking of. We really would want to save somebody else's life first. Next, once you remove the excessive clothing, then put all the things that you can do to cool the person's body temperature. So it may be the shower, it may be the faucet, it may be, whatever, put anything, water, like,
You happen to
fluids
have a
that
bottle
you
of
get to
water?
see. Bottle of water, yeah. Put it. Ice packs if you have, Of course, it's most ideal, But like if you're in outside the area, whatever that you can hold off, that can cool off, you think that can cool off the body's temperature, then please do so, And then if the patient is having, and this I really would want to emphasize, it might be, for some our listeners might not be very ironic, But if the patient is already having heat stroke, please do not give them fluids to drink.
Aha,
Okay.
okay. Doctor.
Right? It might be like, wow, it's so confusing.
Yeah,
Right? The
it
patient's
doesn't, it
patient's
doesn't
having
seem
heat stroke already, That it makes sense that, give them fluid, But then again, if the patient is already having heat stroke, meaning the patient has already have altered consciousness, the patient might be more sleepy and drowsy, not be able to protect himself from choking. So do not give them the fluid. If you'll give them fluids, no, it's because of one person already have altered consciousness, they won't be able to protect themselves. The water will just go inside the lungs, and we don't want it. That will, put more harm than benefit to the person. So, if the patient is having heat cramps, heat exhaustion, please, by all means, give them fluids as much as we can. Fluids meaning water and those with electrolytes. I won't give out names, but
Yeah.
oral rehydration salts, whatever you guys have, but do not give them coffee, tea, iced tea, soft drinks, those kind of can cause more peeing or they're called diuretics,
Yes.
cause more
Yes.
urination.
Doctor, okay.
But I'll go back to my original point. Do not give them if they're having heat shock because of their altered consciousness. They might be choking. If you really think that they need, and you think, they may not be not too altered. They're having heat stroke, but they're just a little confused. But I think the patient can still drink. If you think that way, then put them on a sitting position, and they might need your help in this way. Put them in a sitting position. Make sure it's like really, almost 90 degrees
Upright,
from the ground. You're very upright, And if you have straw, please ask them to sip, because sipping in a sense, it makes them easier for them not to choke. It protects their airway, right? Protects them, their lungs. Then asking them to gulp in big amounts the fluid, and you don't even know if they'll be able to protect themselves. So yeah, do not give fluids to drink if they're having heat stroke, but you can actually try in a sitting position, very upright sitting position, using a straw.
Okay. Thank you, doctor.
There's another controversial thing. If you want to talk about it, I'll get back to it. But there's another controversial thing I'd want to also advise our listeners and our viewers. Again, remember we were talking about heat stroke, 37 degrees Celsius. When you start having 38 degrees Celsius, but you're starting having fever. And when you're exposed to this extreme heat, you might have your body's temperature increase to 40 and even above, right? Because you cannot regulate back to 37. You'll have fever, very high fever. At this point, usually our parents and people would give paracetamol to lower down the fever.
Medicine. Yeah.
Right? But if you're having heat stroke, and again, please do not give them paracetamol.
Yes.
Or aspirin. For our listeners in the US, they usually give aspirin, right? For this. So please do not give paracetamol or aspirin if you're having heat stroke, because it may acetaminophen in the US, paracetamol, acetaminophen, because it may affect our body's response to the heat stroke, or
Okay, doctor. So we have two controversial things that
advice.
you said. Doesn't seem to make sense to
Right.
people not in the medical profession. But we just have to take a short break, doctor, and then I will see if I remembered everything that you said. and go through it, and then you correct me if I'm wrong. I'll just recap right after the short break that we have to take about like what to do when you think someone is having a heat stroke or you kind of know it already. And actually you answered I was going to ask you like, doctor, can we answer it from like the beginning to the point where they get to the hospital? But you answered it without me even having to ask that. So I'll just like kind of try to recap and go through it, and interrupt me anytime when we get back. Correct me if I'm wrong, but we just have to take a really short break and we'll be right back. So stay tuned to talk more about like the doesn't make sense. That's it. It's a cliffhanger. Just a couple of minutes. We'll give you a cliffhanger and we'll go through it again. Why it doesn't make sense to do that with Doctor here. Okay, Austin. We'll be right back. Austin. Okay, Austin Powers. Okay, all right. We'll be back in just a minute. We just have to play a commercial. This is Nicole Jacinto with the host of Healthline with Makati Med. I'm here with Austin. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Oops. Hi, everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. Lately, I've been having this problem with pressing the right button to show my video, but let's not attribute that to heat stroke yet. Right, doctor? Okay.
No.
No, okay. So, doctor, if I remember, just to do a recap for those listening and those who may have just tuned in, maybe they got a glass of water and said, "Oh my God, I don't want to get heat stroke."
You have to drink.
Yeah. Okay. So if you notice, as a bystander or a companion or someone you love, anyone, if you notice these outward signs in a person who may be experiencing first their stages, the heat cramps and all of that, you can maybe and the heat cramps and the fatigue that comes with the exhaustion already. Sorry, the heat cramps and you maybe they don't know why it's lasted for hours. Can that person also, can you advise them, or maybe you suspect that they're having it? You can say, hey, you should go to an air conditioned room or a cooler place. And this is part of the controversial thing, that can you tell them that they should maybe take a drink, like, I mean, I have to say it because I don't know the other, like like those sports drinks.
Yes.
That-
Those with electrolyte
Yes.
beverages.
Yes.
So either one of them is we recognize any of them will be able to help our patients. No, again, I also would want to emphasize, and now we're talking about what to do. No, it's not always about water in heat stroke and heat exhaustion, but also there's a play of electrolytes. No, sodium, potassium inside are very vital electrolytes inside the body that help us regulate the temperature back. And sometimes we also lose this during heat stroke, and trying to give it back just pure water may not always help as much as if you'll be going to give them some drinks with electrolytes. No, any sports drinks that you guys know, as long as there's no caffeine. There's some sports drinks out there that has caffeine. No, please shy away. Do not stay away from giving patients who are exposed or might have heat stroke, heat exhaustion, heat cramps. No, those with caffeine.
Okay, so no caffeine because it's a diuretic. It makes you pee
It
more.
is there. Makes you pee more, so you lose more fluids.
With a heat stroke, you want to keep the fluids that are in the body in. So don't give them
Yes.
coffee. My favorite drink, Coca-Cola. Sorry guys, but I'm just saying.
No.
I have to mention
No.
something. Or other. There are even things. There are even soft drinks or sodas that they're not colored dark, but they have caffeine content in
Also
them.
have
And
caffeine. Yes.
sports drinks. Sorry, I gotta mention a brand because, like, let's say you give them Gatorade or they drink Gatorade.
Mhm.
I think that's okay because of the way it was formulated. Actually, it was
Yeah.
related by the coaches of the Florida Gators, the
Correct.
football team. So it's
Yeah.
been around for a long time, and they actually made it so that their players wouldn't get dehydrated. But anyway,
Correct.
so okay, I mentioned the brands. You guys should sponsor, man. Okay. So all right. So I have to do that because I don't know any other way of explaining it. There's, as you said, also be careful. There are so many other like sports drinks out there, but some of them may contain caffeine, and we don't even know. Or maybe green tea extract. That's also caffeine,
Yeah.
right? Caffeine.
Yes.
It makes for better performance if you're doing sports or whatever it is. But make sure not to give any caffeine because it's a diuretic. It makes they'll pee out more fluids, and we don't want them to urinate too much. And
Right.
okay, I have a question about, okay, so when it comes to it's already, let's say, okay, past the cramps, the heat exhaustion
Caution.
and the heat stroke. I wanted to ask you actually about urination. At that point, is the patient like, is it bad if the patient is urinating too much? Will you notice that? Is that also a symptom? Or if the patient is like not urinating at all? Is there something?
Actually, before you go, yeah, usually what we're very cautious of, if the patient decreases the urine output, no, we call it oliguria or low urine output, no, the patient doesn't feel like he wants to void, then for a fact that the body tries to extract as much fluid as it can to stay inside the body, so much so that it cannot filter out any other fluids. So if you have low urine output or leading to no urine output, it's a red flag already for heat stroke.
All right. So basically, you can give this advice to drink that and to drink more water. Mythbuster. Some people say give them water with salt. Is that true? Is that good? Yes or no?
Oh, well, if you're gonna go back to WHO's recommendation, especially in hydration, dehydrations in patients with diarrhea, they use, not everyone would have access to
Yes.
already processed electrolyte drinks, right? So there's actually, you can, but there's a specific there's specific tablespoons of sugar and salt combination that needs to be in the solution so that it can be effective as a hydration tool for these patients.
Thank you, doctor. Yes, and there are many people, especially in a country like ours, that where there's a lot of poverty. They can't just easily go to a store and buy. It's not just around the
Right.
corner. Okay, go ahead, buy some sport drinks. Okay, go ahead, buy some the solution that we put in the water. So yes, it can be, but there's a specific amount of salt and even sugar, as you said, to keep the body that way. And you did mention the reason for this is you have to watch the electrolytes because that is very that is very important even in making the heart function. Okay, so if I remember correctly, you said okay, when it gets to the stage of heat exhaustion, can you still like what you can you can start by putting the person in a cooler place, then and then can you still give them drinks if it's the point of heat exhaustion?
Yes, definitely.
All right.
If there's no, just to be clear, if there's no alteration in the consciousness if the patient's awake and alert, able to talk to you, able to, please, by all means, give them the fluids that they need.
As you said, if the person is even if the person may have heat stroke, but they're not at the point where they can't, like they've fainted already, or they're they're delirious and you can tell, you can give them water or the sports drinks or any kind of formulation that's good with electrolytes, but make sure they are sitting upright so
90 degrees.
Get a straw, make sure it's easier to sip. And then I just want to explain to the non-medical professionals like me out there, like when, as you said, doctor, one of the things is if they're already having that heat stroke, don't force water down their throat, because the thing is, when we swallow, it can go to, if our inner organs are not working properly already, because the heat stroke has affected it, that water, like when we swallow, one hole closes and we're conscious, it has to go down to the right hole, to the stomach, through the
esophagus.
Esophagus. And then if they're unconscious and we just kind of like waterboard them, then it can go to the trachea and go down to the lungs, and that will cause more problems.
They can drown from it.
They can drown. Choke, they can drown. So that's why you said, okay, it seems to make sense that when they're in their heat, when they're at the highest point of their, heat stroke, that you would want to do that. But can you put water on them, throw water on them? Or,
yes, definitely. Throw water especially the groins, the armpits, the nape area. That's where all the heat is, so
you can put ice
packs if you can.
Excess clothing,
remove the clothing.
Yeah, up to the point. If the patient says, "Go ahead, I want to be naked," then do it, because it's to save a life. Okay, and when so that one you have I'm so glad you said that, because of course people make that assumption. They're trying to do good for the person, but it could get worse before they get to you in the ER. Now, when you also said don't give them paracetamol or acetaminophen or anything else, because the tendency is, especially you said parents, when it happens to their kids, oh my God, the person is having a fever, let's start bringing it down already while we're bringing, let's say, the patient to the doctor. Do that because it could affect the baby, basically
body's response.
Okay, the body's response. Okay, the body's response to the heat stroke. So once a patient gets to you and they have heat stroke, how do you treat them?
Usually, of course, we still do the primary survey. We check the airway, the breathing, the circulation. As emergency specialists, we have to make sure everything else is okay. Check for vital organs, and then we start IV hydration. So we start the fluids intravenously, put it in the vessels, the blood vessels directly. Of course, we compute it. We also monitor the urine output, which is one of the things that you mentioned right a while ago. Very important to check for any signs of dehydrations. And then we get some blood samples to check their electrolytes. Because another, it's not just about water, but also the electrolytes when you're having problems in heat stroke. So we check them and correct them as soon as we can. We check for any organs that might be affected of the heat stroke. But while we're doing that, again, the paramount, number one management is to regulate back the body. If the body cannot do it itself, then we have to do it. We apply cooling blankets, to put ice packs, or even our saline or solutions are cold, not put back the temperature, the core temperature to a cooler degrees.
And the IV
So,
is cold. The suero, the IV is cold.
yes,
The liquid.
yes. If it's yes, we usually use that. But if it's not, I mean, not all hospitals. Maybe like you get to find in a rural areas that may not have the capability to have those kinds. But even the IV hydration itself can actually cool. I usually use this as for the layperson. I try to explain it this way especially with parents. No, I always think of the fluid inside our body as the coolant, no? So freon, if you will,
Freon.
in air conditioners. Yeah. So that's what I use. Of course, don't use freon. I mean, use it as a pilot. It's a coolant, right? Now, if you don't have enough coolant inside your body, you don't have enough fluids inside the body stops putting back it in a cooler temperature. So given IV hydration will give back the coolant, right? And makes it easier for the body to regulate it back.
Doctor, what happens if we leave heat stroke untreated? From the best case scenario to the worst case scenario?
A best case scenario, of course, please think of heat stroke as something that can, be reversed. It's a reversible, again, it's physiologic, right? It's reversible. But even if that's a best case, no. And please make sure that you get to be in the hospital, have the most medical management that we can do for you guys, so that you can reverse it. But I do not want to discount the fact that people die
That's the
from
worst
heat
case.
stroke. Yeah, that's the worst case scenario. I just want to let people sink it in that that they can actually die if it's untreated. We don't want that to happen to you. That's why we're here. Makati Medical Center, we're 24/7. The ER, best place for you guys to be treated properly. But between the best case and the worst case
Yes, let's talk
scenario,
about
so
the
best
middle.
case is reversible, and the
Yeah.
worst case scenario, in the middle, it can cause temporary to permanent vital organ damage. When you're having heat stroke, again, it's because imagine your bodies into this fire, and that's not supposed to do. Some of our organs gets to be inflamed. Our livers gets inflamed, our brain gets inflamed, our heart even works so much during these times, or even our kidneys can fail. So that can cause, eventually leading to temporary or permanent
You don't want to get kidney failure and then have to
organ.
do dialysis, whether it's temporary or permanent. You don't want to affected your liver, or as you said, you can be intubated. You don't want your brain to swell, so
Yeah.
so basically get treated, no? And then I mean basically get treated for it. I mean, you don't just, if you don't treat it, someone's there already with heat stroke, so you just left them to die, right? Or have
Right.
this damage. And then sometimes doctor also like people should respond right away to these symptoms, because they may bring the patient to you kind of too late. Does that happen?
Yes. Yeah. Yes, definitely. And I want to discuss it also in the context of risk factors. So of course,
Yes, but
some patients
how are we
who
going to prevent getting heat stroke, or what are the risk factors
Right.
in like how we behave, that, or what we're exposed
correct.
to give us heat that can lead us to getting heat stroke?
Heat stroke, yeah. So number one is age, right? So patients who are less than 4 years old, or even 5 years old, if you may, as not their ability to regulate their core temperature is not as mature as it is in an adult. No, so they're also having difficulties. They might be more predisposed to heat stroke, or those are elderly, 60, 65. Their skin is not, they're not able. They're usually not able to hold down more moisture than it does before, no, or they also have some comorbidity, some other diseases that can affect, or medicines that they take in that can affect their capability to regulate back their temperature. Those are exerting much effort in hot weather, no, from our farmers, no, fishermen, no, those are in angkas, right? Even our office workers that does angkas every day, they can be exposed to those, or angkas or any of those motorcycle grabbing
Mm.
companies, or sudden exposure. You said a while ago, no, some of our tourists can, they're really so used to very cool and cool temperature, goes to the Philippines, got shocked because of the heat, and they're not so used to it. The ability of the body to regulate it might be, surprised as well. So they might have also heat stroke. Those who are having lack of air conditioning or good ventilation. And this, again, I want to emphasize those are drinking alcohol. Alcohol is very notorious as a risk factor for heat stroke. It gets you pee and urinate a lot more, and then you don't, able to.
Dehydrated already. Yeah.
Yes, and also our consciousness about like the symptoms that you're experiencing.
Mm.
Usually, it's blunted, right? Your response to what you're experiencing is also blunted, so you don't get to recognize it right away. It might cause heat stroke also.
Am I still down
Again, of course,
Am I just hot because of the alcohol? You don't recognize anymore
very
what?
nice. Yeah.
Okay.
Being dehydrated, again, as I mentioned, certain medications like diuretics, no, or they're taking antidepressants, antipsychotics, no, those who are ADHD or taking some medications can also affect it, or certain health conditions. So
Okay.
meaning these things can be prevented. If you have risk factors, then we can also prevent patients
Yeah.
from having heat stroke. So wear loose fitting clothes, no, white clothing, protect against sunburn. Sunburn also, if you have sunburn, it also destroys your capability to regulate your temperature on the skin. Drink plenty of fluids. Again, I cannot overemphasize. Avoid coffee, tea, soda, alcoholic drinks. Take
Mm.
extra precautions with certain medications. Please talk to your doctor about it. No, never leave anyone in a parked car. No,
Mm.
you're younger, right? Your kids, no, sometimes, no, sandali lang, 5 minutes, I'll go to the bank, whatever, no, but please do not do that, no. um or even your pets, no, so even our
Yes.
fur parents there, no, please do not leave your pets, no, they can also suffer from heat stroke. Take it easy during the hottest parts of the day, no, around 10 2 p.m. No, if you can try to shy away from going outside, go to a shade instead. Please do so, so that it can also be prevented. Get acclimated. No, so meaning, if you go to a place like ours, no, if you're coming from a cool environment or you're coming from a very cool room, no, before you go out at the heat, no, try to lower down the temperature first, or expose yourself to warmer than before going to a hotter place. And
Mhm.
lastly, be cautious if you're at risk. We already mentioned who are those at risk. So if you know that you have some risk factor, please be very careful and be very cautious of like the experience, what you're experiencing
Doctor,
already.
do you have anything to say? That I just have to say this. But I'll give you the final word. Like in the state of our country today and the weather, and we know it's due to
Mm-hmm.
climate change, so we're feeling it. And then also
Mm-hmm.
like not everybody can afford to be in air conditioned places. As we said, our
Mm-hmm.
farmers, our fishermen, people in the province,
Mm-hmm.
with the state of the look, we're having economic difficulty and there's a lot of poverty.
Mm-hmm.
And like, when you're out there in the provinces and everything, any other tips you can give them? Sometimes people will choose between, they can't pay for electricity, not even an electric fan, or they don't
Mm-hmm.
have access to enough clean, safe water to like
Mm-hmm.
bathe all the time and cool themselves down, or even drink. Are there any tips you can give
Mm-hmm.
them? Well, you did mention one, wear white clothing. Why white? Because it deflects the heat.
Wear one.
Any
Yes, wear white clothing, deflects the heat. No, well, again, I hope I will not be crucified because of what I'm gonna say, but very practical. If you'll be able to like be in a place that there's an air conditioning. I don't want to mention establishments, but like especially in the patients are in the urban setting, please, if it's like in the hottest time of the day, you can stop by and go inside. I don't think they'll be asking you to pay for just to be in the cooler area. But
No,
yeah, but like those.
I don't want you to get like to feel pressured or stressed out. Basically, do
No, no,
everything.
no, no, definitely that you can to make sure your temperature is cool, and try to again. I want to emphasize also try to avoid to be in direct sunlight during the time of the day when it's hottest, like 10, at least 10 in the morning until 2 in the afternoon. Sometimes it usually gets really hot even at 9, but like 10 to 2, that's the hottest. So please try to avoid to be in direct sunlight. Go to a shaded area, to cool down. Try to rest a bit, and yeah, try to be as very cautious as you can. Again, also about knowing what your risk factors and your symptoms, as we're trying to discuss it, so that they'll be also knowledgeable of what they're experiencing. They get help.
Thank you, doctor. We are out of time. Kakampi Bernard Tan is here already. Hello, Bernard. Don't forget. Stay tuned because Bernard Tan is on already, si Kakampi. And doctor, thank you very much for your time. If you'd like to say hi to anyone before we go, would you like to say hello to anyone?
Well, hello to my mom, but yeah, thanks everyone for tuning in. And again, thank you for having this platform to discuss these things. And if you guys, again, anything that you think of, any need, please do not hesitate to call a doctor. Find us at the emergency department of Makati Medical Center, which is located in 𝗛𝗲𝗶𝗁𝗁 in Makati. At any time, we're 24/7 open to give you anything that we can and can help you in any way we can, so that we can, prevent things to happen, worst case scenarios.
Thank you very much.
Thank you, Nicole.
Dr. Austin, and hi to Austin's mom. Okay. All right. Thank you, everybody. Stay tuned for Kakampi Bernard Tan. Thank you for your patience, Kakampi Bernard Tan. Okay. We'll see you guys next week. This has been Nicole Jacinto hosting Healthline with Makati Med. Everybody take care and stay out of the heat. I'm going to take off my shirt now and drink a glass of water. Okay. Bye-bye.
Thank you.
Thank you.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.